I'm just looking at Patricia's feet and just imagining that she was probably walking on a tree that was on fire.
This week on Bondi Vet.
As soon as the fires hit, we very quickly accumulated a lot of animals with severe burns.
Fire line is only 6 kilometres away from us, so I made the decision that we had to get the animals off.
We have to monitor her very closely and hope that she wakes up, because the longer she's in this coma, the less chance she's got.
At number 5 today.
I'm actually heading out to the South Penrith Veterinary Clinic. So they've got a lot of injured animals that have been dropped off at them with burns and smoke inhalation.
SASH emergency vet Lisa Chimes has been called to a clinic near the fire zone.
Hello.
Hi Lisa, great that you could come.
Thank you.
We're inundated with bushfire victims.
Dr. Robert Johnson has been working non-stop since the fires passed.
Over here we've got possums, and we've got more ringtails than I thought we'd get, because I think they've all been displaced from their habitat. They're normally shy and secretive animals.
Oh, goodness. So who's in here?
So this is Patricia, so she's a little female brush-tailed possum.
Patricia is suffering deep burns to her ears, face and feet.
Those burns look pretty nasty, and I think if we don't get onto them quickly, they're going to get infected, and it's not going to be good news for her at all. So at the moment what we're doing is we're giving Patricia an anaesthetic, and the reason for that is because she's a wild animal. She's not used to being handled by people. She's got really nasty burns on her ears, almost 3rd-degree burns. We've really got to treat these quickly, otherwise she's not going to survive this. Burnt the tip of her tail as well. Poor little thing, huh?
At the South Penrith Veterinary Clinic, Lisa's dealing with a badly burnt possum.
I'm just looking at Patricia's feet and just imagining that she was probably walking on a tree that was on fire. She's burnt the tips of her ears, she's burnt her face.
Can you see that, Lisa?
Oh,
look, those little curly whiskers.
Burnt her whiskers.
Yeah.
Oh. It's just so upsetting to see burns on our wildlife. It has got to be agony. If these don't heal, Patricia's got no chance. What we're doing now is we're applying some really good antibiotic cream, and we're hopefully going to stop any infection from setting up. It's early days. I don't know if we're ever going to be able to get Patricia to a point where she can be released, but all we can do is try. She'll wake up soon, hopefully. Yeah, honey.
But Patricia is not responding.
Hey, honey, wake up. She's survived a raging bushfire. She's come out with these burns. We just cannot lose her now. Hey, honey, wake up. Hey. And she's definitely taking a long time to wake up from this, and a healthy possum, I'm used to them bouncing off the walls as soon as we take that mask off.
Patricia, the badly burnt possum, isn't recovering from an anaesthetic, and Lisa is worried.
It makes me concerned that she's actually got some smoke inhalation in her lungs, and that's what's causing this slow wake up. I really, really hope she comes out of this quickly. Pop her into a nice warm bed and hopefully she wakes up quickly.
Oh, sweetie. Good girl. Patricia.
Thankfully, she started moving. She started waking up, so big sigh of relief from all of us, I think. Now we just got to wait and keep treating these burns and hope like hell that they get better. We could give her some food while she's having a little leak.
Give her some food now to distract her.
I want something to eat. Oh. Patricia's feeding really well. She's tucking into this pureed apple, and it makes me think that she's got a fighting chance. Oh, you're a good girl.
With the Penrith surgery full, Lisa decides to take the recovering possum to the Bondi clinic.
Come on, Patricia, let's go. Hi, Andrew. How are you?
Good. What do we have here?
Lisa has brought little bushfire victim Patricia to the Bondi clinic to recover.
She's got burns on her feet and on her ears. They're quite bad burns, but overall she just needs a lot of care. Bye, Patricia. I'll see you soon. Thanks, Andrew. I'll talk to you.
See ya. Alrighty, Patricia. No more bushfires out here at Bondi. I'm just going to pop you into a nice cage with some flowers and a fruit salad. There you go. So the plan for Patricia now is to set her up with some food and water, give her a nice dark environment and just give her some rest. Lisa and all the vets here are going to take great care of you.
Hey, Andrew.
Hey Lisa, how are you?
Good. How's Patricia been?
She's doing good.
Yeah?
Yeah, we've been making some good progress.
Oh, good. I'll go grab her, have a look.
Alrighty.
Lisa is at the Bondi clinic to check up on a little bushfire victim.
She wasn't in a very good way and we were worried about infection and whether she was even going to make it. So I'm really hoping that today she's looking a lot better. Hi. How you going, Bubbalo? Hey. What have you been eating? Oh, look at you. You look fantastic. She is a completely different possum. She's eating really, really well. This is a good sign. How are you doing? I know. She's definitely more feisty than she was. That's for sure. Hey?
We've noticed a lot of improvement in her ears.
Yeah.
They're not resembling crispy bacon as much as they were when she came in.
Even though they're not the most fashionable ears in town, the dead bits have fallen off and now new healthy tissue is growing and this is looking really good.
Her paws have come down a little bit.
Yeah. The tips of those toes have been burnt off and they're just starting to heal. There's some blood there, which actually means that there's blood supply and the tissue is nice and healthy. So it's going to take some time for them to return to normal, but it's definitely a huge improvement compared to how they looked. Yummy.
We've been hand feeding her as much as possible just to stop her using those little hands.
Yeah, no, that's really good and she's eating well, which is fantastic. Next time I pop in, I am hoping to see even more of an improvement and the way she's going, I think she's going to be just fine. You're a good girl. Good girl. You're a good little thing. Hi.
Hello, how are you?
Good. How's she going?
She's good. She's so much better. Good girl.
Lisa is back at the Bondi clinic for a final checkup on bushfire victim Patricia. It wasn't long ago that the possum was clinging to life.
Her skin has healed very well.
Oh my goodness, look at those ears.
And she's got her spark back, so she's pretty keen to...
You want to get back out in the bush, huh?
Yeah.
There you go.
Alright, sweetie.
Wow, Ali, that is just a massive improvement. They were red, raw and oozing and completely scalded and now that's just normal tissue. So
yeah, I'm amazed how well they've healed because there was barely any skin there.
They're pretty amazing, resilient animals, aren't you, sweetness? When I met Patricia, she was this poor, helpless burn victim. And then I look at her now and she is full of beans. Her paws have healed up, her whiskers have grown back and she's ready to climb up that tree again. Come on, Patricia, let's go. Come on, Patricia, look where we are. Hello.
Lovely to meet you.
Nice to meet you as well.
And this is Patricia.
This is Patricia. I'm here in Mulgoa, which is in the lower Blue Mountains, and I'm at the home of a carer called Pam. She works for Wires, and she's actually got an aviary here where Patricia's going to complete the last little bit of her rehabilitation. This is your new home. I think you're going to love it here. All I'm hearing is the piercing sound of cicadas, but that tells me we are in the bush and that is the perfect place for Patricia to begin the next part of her rehabilitation. Go, Patricia! Come on, oh, good girl. Look at you. That's so lovely. That's it. Hey, good girl. I'll really miss Patricia. She has been a fabulous little patient and hopefully in the not too distant future she'll be up at the top of the tree looking down on all of us. Be in touch. Please let us know how she's going. Indeed. Thank you.
Number 4.
Chris and one of the Bondi Clinic interns, Ali, are answering an SOS after devastating bushfires on the outskirts of Sydney.
Hi, how are you?
Hi.
I'm Chris, how are you?
Nice to meet you.
Nice to meet you. This is Ali.
Hi, nice to meet you.
Now, where's the alpaca?
Through here.
Through here? Oh, so this is in here.
Yeah, this is little Jersey.
Hey, little guy.
And his mum fine.
He looks exhausted, doesn't he?
Yeah, poor little fella.
The tiny alpaca is just 3 days old.
So these guys were evacuated from the fire zone?
Yep. I was hoping it would all be okay, but unfortunately not.
I mean, they don't react to stress very well, do they?
No, no. Our farm is under threat of bushfires. The fire line is only 6 kilometres away from us, so I made the decision that we had to get the animals off.
Fine was lucky that Debbie managed to get her out of that bushfire zone in time, but in the stress of being shipped out of there, it's brought on the early delivery of her little baby. And now Jersey is fighting for his life. He's just been lying around like this, has he?
Yeah, he tries to sit up sometimes and then he's exhausted again.
Yeah.
When Jersey first came out, he was limp. Normally within an hour they're up and feeding and they're fine, and he wasn't moving. He was laying there shivering.
Certainly when they're premature, they're not as fully developed, but even so, for him to be this weak and just to be lacking energy like this, I'm just a bit worried there might be something else going on with him. You look at little Jersey and he looks barely alive. Now, even though he wasn't burnt by the bushfires, they could still cost him his life. Yeah, obviously the stress explains why Mum has done what she's done, and been taken out of her home environment, trucked down here, obviously has a big impact. Now her problem has become her baby's problem. And I guess that's what we need to address here.
Chris and Bondi Clinic intern Ali have been called out to help Jersey. The 3-day-old alpaca has barely moved since birth. His mother was stressed into a premature labour by the bushfire evacuation.
The first thing I noticed is just how incredibly weak this little guy is. He's having trouble even raising his head. He really should be bouncing around, and he, importantly, should be feeding as well. He's doing neither of those.
Temperature's 38.3.
Okay. I just want to check his light reflexes, just in his eye. So mobile phones can be very handy.
Yeah.
So I'm checking two things. First of all, just to see if he has some response to that bright light, but also just to see if he's got any flicking in that eye. So if his eyes are flickering back and forth, then it can indicate that he's got some sort of brain dysfunction at the moment. Okay.
They're relatively stable there. He just shouldn't collapse like that.
Yeah.
On the outskirts of Sydney, Chris is looking for clues as to why Prem baby Jersey is fighting for his life.
He just shouldn't collapse like that.
Yeah.
Nothing truly explains why Jersey is so flat. Then all of a sudden, Debbie tells me something that may unlock this whole mystery.
After she had Bub, I noticed her legs had a lot of blood on it, which is quite unusual. They're normally clean.
It's interesting. Having the blood on the back of her legs isn't a normal thing.
No.
It's possible that because she was under stress, the umbilical cord hasn't torn correctly, and he actually may have lost a lot of blood at that time. Now, if he's lost a lot of blood, I mean, how does an animal that's anemic behave? Exactly like him.
Yeah,
very weak, very floppy, very tired. And without that blood, he's also at risk of infections and also at risk of developing other problems as well. Knowing now that Jersey's birth was accompanied with a lot of blood makes me worried that he's anemic. He needs one thing, that's blood transfusion. So we need a very, very generous alpaca. You know any around here?
Oh, definitely. I can pick you one.
Okay.
Chris has come to the aid of 3-day-old Jersey. The little alpaca is clinging to life after being born prematurely during a bushfire evacuation.
My hunch with Jersey really revolves around two things. First of all, he's anemic and he's lost some blood during the act of being born. But secondly, he's missing some antibodies. Really, the perfect medicine for Jersey right now is blood transfusion.
But first, Chris has to catch a willing donor.
All right, now which one's Boston?
He's over there.
He's the taller one in the middle there?
Yep, arms up.
There we go, good man. A very important job to do. All right, buddy, let's go. Even though Boston is a very calm alpaca, he still may not take too kindly to me taking about 200 mils of blood out of his jugular vein.
Good man.
All right, now when I touch there, I can see the jugular moving up and down. So we're in the right spot. Little burp, Boston.
No, he's about to spit at you.
Is he? That's what you want to hear?
That noise was.
He's just getting one armed and ready. Fair enough, I'd be doing the same thing. So you can see it's already running quite nicely there.
Beautiful.
I may be trying to sweet talk you right now, but what you are doing is very generous and very kind, and it's going to make a big difference to a young alpaca's life. So I appreciate it, and I'd also appreciate it if you didn't spit on me once we're done. How's that? All right, so that's a good amount of blood there. Thanks, Boston. Thank you, buddy.
Thank you.
My hope with this blood transfusion is really two things. First of all, it'll mean more red blood cells in his system and therefore more energy. But secondly, he's getting a big hit of antibodies. Both of those things combined should really perk him up.
There we go, mate. Being very brave.
Seeing how weak he is, the fact is this blood transfusion has to have an effect soon. Otherwise, our little mate's in big trouble. All right, all done. Yep.
Chris has just given Jersey a blood transfusion in a bid to save the newborn alpaca's life.
I'm hoping his body is now being filled up with energy, with antibodies. He's going to be carrying so much more oxygen around. All I can do right now, though, is wait.
But now Jersey's mum also needs Chris's attention.
All right, so we need 2.5 mils for her.
An antibiotic injection should prevent any post-birth infections.
Oh, you've been very good.
She was trying.
She made her feelings very, very clear though. Okay, so that should be the whole family taken care of. This time where you're waiting for your treatment to take effect, minutes can seem like hours.
It's now been 20 minutes since his transfusion, and so far, Jersey has failed to respond.
Everybody standing up?
Chris has performed a blood transfusion on 3-day-old Jersey. The preemie baby has barely moved since he was born.
Come on, little buddy, come on. Nice work.
This is just amazing.
First steps.
Well done.
Thank you. I'm relieved. He looks good.
He's never done this before. This is just amazing.
That's great. It's really good. Jersey's hopped to his feet and run straight over to his mum and suckled for the first time in his life. It's incredible.
So cute to hear him sucking.
When you meet a little guy like Jersey whose life is in turmoil, you hope that in some way you can make a difference. And seemingly today, we've done just that.
Come on.
As for Jersey, the little alpaca has now fully recovered from his difficult start to life.
I didn't think Jersey would live, straight out. After 3 days of him not improving and in fact getting worse, I didn't think he had a chance. So I think what Chris did was just amazing. He's obviously saved his life, and he's just gone from strength to strength. He's playing with all the others. He's just a normal cria now, which is just wonderful.
To have a chance that you've taken pay off like it has with Jersey is just one of those incredibly special things. Jersey is one of the truly unique bushfire survival stories.
This week's number 3.
Wow! Mobile vet Audrey is making a long-distance house call today near Canberra.
We're very excited to see 20 or so patients there, just checking in on them today.
Audrey's meeting up with Rosemary at the busy Possumwood Sanctuary to check up on some extra special patients.
Hi, Rosemary.
Oh, hi, Audrey.
Nice
Didn't
to
see
see
you.
you. Rosemary and Steve are the owners of Possumwood. They've been rehabilitating wildlife, looking after kangaroos, and they've been doing this for over 20 years, which is amazing. Their role in the recent bushfires has been so important for these guys to recover in a safe place.
Ready for a nice busy weekend?
I am. How are my girls going?
Oh, the girls are pretty good. And as soon as the fires hit, we very quickly accumulated a lot of animals with severe burns. Audrey has been a godsend to us. Come to say hello to her. Having a vet come here, it has made our job so much easier because it's very difficult. You can see she loves animals, and that's very important to Steve and I, that we have a vet here who actually loves the wildlife.
Home sweet home. Hello, Cinders. Hey, Rusty.
At Possumwood,
Hey, Pouchy. How are you going, my girl?
the animals get loads of TLC, including free run of the lounge room.
Looks like everyone's here today, so we might as well get started. This is little Hawthorne. He's about 8-9 months old, we think, and he was found trapped in a fence by one leg. And usually when they're hanging from one leg, they can do quite a lot of damage because they're flailing around trying to get out. So he's got quite a deep wound just on his foot there that we're dressing, but also we feel like some of the nerves have been damaged. Hey, Reese. Here's Hawthorne.
Hello. How you going, Hawthorne?
A little boy fence hanger.
Audrey and animal rehab therapist Reese have been working together to treat these injured and traumatised little patients.
Reese is going to do some laser therapy on him, and we're also going to re-splint that leg and just see how everything's going.
So I've got a little pair of, well, they call them doggles, they're for dogs, but in this case we're putting them on kangaroos to protect his eyes from the laser. There we are. Do you want some doggles too, Audrey?
Oh,
some
fancy.
for you. Some for
Why
you,
does
Brie.
he get fancier ones than me?
It will be a long road to recovery for brave little Hawthorne, but everyone is hoping one day he can go back to the wild.
All right, so we'll just take off that last layer. So we got a blob of honey actually there. So we're using the honey quite a lot if we've got deep wounds to help it granulate and heal. It's also really good at keeping infection away. Last week when we had a look at this wound, it was quite deep and we could actually see through to almost the tendon, but that's sealed over quite well just from the manuka honey, and it's actually got fresh granulation tissue in there. So we're pretty happy with how that's healing. And I guess we're just gonna have to look at how he's moving this toe, which was the concern last week.
The laser enhances the body's natural ability to heal, so what we're going to come up with is faster healing times for the injuries.
With any leg injuries with kangaroos, it's so important to fix it and fix it fast because overall they only have 2 legs and a tail to move around. And if they stop using that leg, they can put a lot of pressure on the other one.
All right, all done, mate.
Take off your cool goggles.
Oh, how's that?
Oh my God, he's so cute. Oh, there we go. Hopefully he does fully recover and we can get him back to where he came from, because the sad story is we did have to take him away from his mum when he was trapped in the fence, and he still does call out for her quite a lot. That's his mummy cry. So if he heals up, we can get him back and maybe he can find his mum again.
At Possumwood Sanctuary, Audrey's next patients are mother and daughter, Indiana and Nino.
There you are, Indy and Nino. Big day for Indy and for all of us. She was actually a bushfire affected girl. Nino's her little Joey. It's the final check before we see whether she can go to the outdoor enclosure. So that'll be the first time she's allowed out without bandages. Indiana came in at the very beginning of the bushfires. She was actually in another sanctuary where they have a big enclosure for kangaroos, and a massive fire roared down the mountain and actually hit the enclosure. And she is a very protective mother. So she ran back through the enclosure just straight into the fire to try and find Nino. You can actually see her ears are completely singed. They're all kind of crinkled at the top, and her eyelashes were all burnt off. Indy's feet were probably one of the worst. They were completely burnt on the underside down to pretty much tendon. So you can see that the bottom of the feet have healed really, really well. We're very happy with that. And I think, you know, clean bill of health, so she gets to go outdoors today. Indiana is the biggest couch potato you'll ever find. She and her Joey permanently stay on the couch. They just love it. Oh, look at that. I'm hoping today she tries something different and has a bit of a wander outdoors for us. I think if we move Indy, because Nino's attached at the hip, he'll just follow.
With Indy and Nino looking a bit too relaxed, Audrey's going to need some help from vet nurse Brianna.
This way, this way. She just loves her couch. Stop being a couch potato. We got to go outside to the sun at some point in your life.
These girls aren't too keen on giving up their very comfy couch.
It's definitely harder herding kangaroos, especially kangaroos that love couches.
They're not cooperating today.
Why don't you carry Nino and I will coax Indy.
All right, Nino. It's been a long journey, but here we go. Let's go.
Come on, Indy.
Look. There we go.
You get Nino. As you can see, it was so hard getting them off the couch because she's turned into a big couch potato. It's so nice and warm in there. It's so great just seeing her jumping and hopping. She's come such a long way, and to have her baby with her the whole time has been great.
It's hoped the next adventure for these very brave girls is back in the wild where they belong.
Hi, Mama. Good girl, Indy.
Number 2.
At Sash, a major bushfire is burning, only 100 metres from the hospital. Catherine and Barry had to get through roadblocks to bring in their critically ill pet.
She's been bitten by a snake, she's collapsed suddenly, she's having difficulty breathing, she might need to be ventilated.
14-month-old Dora has now slipped into a coma.
What worries me is that she's actually not waking up, and I'm concerned about her brain function.
Dora is just clinging to life, but she did kill the snake before collapsing.
As Catherine walked around the backyard, it was right in the middle of the yard, and it was a black snake and it was dead.
And huge. Just quite heartbreaking at the moment, but you know, just trying to stay a bit upbeat and think, you know, if she can kill that snake, she can do anything, I think.
The snake venom is attacking Dora's system.
So the most important part about treating a snake bite is that you need to get the anti-venom into the animal straight away, because you want to try and stop the venom before it binds to the tissues and has any more disastrous effects. I don't know if Dora's going to make it. All we can do is wait for the anti-venom to start doing its job. We have to monitor her very closely and hope that she wakes up, because the longer she's in this coma, the less chance she's got.
Good girl. That's my good girl.
She does respond to your touch.
At home, Barry and Catherine's 5 children are waiting for news. A soft toy sent in from their youngest child is placed next to Dora to comfort her.
I'd like to sit here all night with her.
Get a bed next to her.
I won't sleep. Okay. Okay, so any change you'll obviously ring us?
Yeah.
I won't be sleeping anyway. Fighting. I'll see you tomorrow. Love you. Okay, thank you very much.
Thank you.
Bye.
Thanks.
You know, you just have that big stone in your heart. It's just horrible when you are not sure what the outcome will be. Like, that's the heartbreaking thing, I think, is that at this stage it can go either way.
Outside, firemen are winning the battle against the bushfires. And as Catherine and Barry get ready to leave, there's suddenly an unexpected breakthrough for Dora.
Good girl. Look at you. Okay, okay. Oh my goodness. Look at you. Dora. Dora. Oh, that's amazing. I'm gonna go get them. I just can't believe this. I really can't. She's away.
Oh my God.
She is seriously away.
Are you serious?
She's looking around. You won't believe it.
The brave girl. Who killed the big snake? Who killed the big snake? I've got the shakes.
Such a quick recovery. I don't think I've seen one quite like this. You're being demoted to a cage. That is good news. There is no doubt that this has been a miraculous recovery, but Dora is not out of danger yet.
Okay, when I go, I'm just going to have to walk away.
Yeah.
Walk away and we're here with her. That's okay.
Is the tail wagging?
I'm not looking.
The problem with snake bites is that they cause internal bleeding and muscle breakdown, which can lead to kidney failure. So Dora needs to spend a lot more time with us in hospital before we can work out exactly what damage that snake has done to her.
If we could choose between winning Lotto and having Dora back, I'd have to turn down the Lotto, sorry.
Hey, little darling girl, look at you. Oh my.
It's 12 hours since Dora arrived at Sash in a coma after being bitten by a snake.
You're a lucky girl. Yeah, you know how lucky you are. I don't think you realise.
Despite regaining consciousness, the venom left in Dora's system is still breaking down her muscles. It's not the news owner Catherine wanted to hear.
So this has really knocked her system around and she's still a very sick little thing, so she's still got a way to go, so I don't want you to get your hopes up, but she has made some really good progress.
Oh, who's a good girl? She's still really, really sick, and so it's quite sad to see her obviously in so much pain.
Give kisses to Mum.
Oh,
okay.
A little grunt.
Okay, I'm just going to pop her in the bed. Just what? You're going home.
Dora has won her battle against the effects of a snake bite.
Let's see you. Oh.
And the whole family, including her canine buddy Dixon, have arrived at Sash to collect her.
I have never discharged a dog to that many people at one time. It was nothing like I've ever seen before, but there was a lot of love.
I don't know, it just feels so good to have her here with us again.
All right, everyone, so strict instructions. Dora has to rest now for 2 weeks.
Yep.
So no playing, no snake catching.
No
Dixon,
snake catching.
you've got to keep her quiet too.
Yes, she's a good girl.
Yeah, good girl, okay? You get better now.
And this week's number 1.
Morning, Dr. Kate.
G'day, Jim.
How are ya?
Nice to see you.
Kate's travelling from Bondi to the Australian Reptile Park today to help Tim with some extra special patients.
After you.
There's 3 of them in here.
3. We rescued some platypus throughout recent bushfire and droughts. They faced a certain death. We've rehabilitated them, and now it's time to release them. People are fascinated by platypus, and it's no surprise. They're living, breathing dinosaurs. The first platypus was sent back to the motherland, Britain. And the scientists there thought it was a hoax, that someone had taken the bill off a duck, the tail off a beaver, and sewn this creature together. Turns out it was just the Australian platypus.
Tim wants Kate to check on 3 of these fascinating creatures, all rescued from horrific bushfires.
I'm hoping that today you look at the plats and they've maintained a stable weight of about 850 to 900 grams.
Yep.
When they came in, they were 300 grams.
Wow.
Absolute skin and bones.
Wow.
We've brought them back to health over the past 6 to 8 months.
Yeah.
And hopefully, with a clean bill of health today, we can let our first go.
That's great.
The fires were devastating. Countless platypus would have perished. The few that we did find, we intervened and we rescued. There's 3 in this maze. And the whole thing is that they're hard for us to find, which is intended to give the platypus a sense of comfort.
Yeah, I mean, it's a burrow, right?
It's a burrow. Oh, here we go. The best way to hold platypus is by the tail, whether it's a male or female. Now, if it's a female, it's okay then to begin and handle a little more normally and you let the tail go. So this female came in on death's door. She was young, but I think her whole growth was stunted.
Yeah.
And the other platypus are biting her on the tail.
Yeah, right.
Because she's small, she's disadvantaged.
Suddenly, this lively little female gives Kate an unexpected surprise.
Oh! When platypus are stressed, they have a substance. It's disgusting, it's oily and it stinks. It's not urine and it's not feces. It's made to deter predators.
Oh dear, it's just never ending. Oh my goodness.
I've been hit in the eye before. It's horrible. Can you smell it?
It's like a skunk-like reaction. You know, she's stressed in a defensive position. Ugh, it stinks. Yeah, she's gorgeous. Oh God.
I've been hit in the eye before. It's horrible. Can you smell it?
Ugh, it stinks.
At Tim's Australian Reptile Park, Kate is checking on some little bushfire survivors.
Have a look at you, little monkey.
Beautiful, hey?
Beautiful, nose good.
One platypus isn't keen on all the attention.
I know, sweetheart. Gosh, she's good weight.
Yeah?
Yeah, I mean,
you can just feel it, can't you? Yeah.
Platypus, you can tell quite a lot from their coat. When they do get sick, they quite often are not as water resistant as when they're well. But she'll be all right.
Yeah.
Her body condition's great, meaning she's pretty fat.
Yeah. Well, we've got a little bit of a soft spot for her, so that doesn't surprise me. She was in incredibly bad health, so the fact that she's carrying a little bit too much weight now is okay.
Hopefully this lively girl can soon be released back into the wild.
Here you go, sweetie. Go over here. One.
What have you got there?
Male.
Male.
Yeah, 100%. So we can very quickly see the spurs.
Yeah.
I'll put a glove on.
Yep.
Kate's next patient has to be handled with extreme care.
And at all costs, you stay away from those spurs.
Yeah.
Male platypus carry venom, and they have a spur to deliver that venom. It's on the inside of their back legs, and it's one of the most painful bites or stings on Earth.
Buddy, don't spur me.
Ooh. I know of 1 or 2 people that have been hit. They go on suicide watch because the pain is non-treatable. No morphine, there's no painkiller drugs.
Yeah.
They want their hand chopped off, and it doesn't end.
Let's not get spurred. This male is a total wriggler. He just wants to get away. He will fight to the death if he has to. Okay, calm down. He's trying really hard to get his back legs up so that he can get me spurred, and there is no way that's going to happen. That's great. His weight's been stable?
Stable. So he's at 950 to 1050.
Yep.
So you think my thoughts are right? Get these 2 out?
Just hold it for a couple of weeks.
Yeah, that's good. So they can go in. We'll make a plan for a couple of weeks from now.
Great.
I'm just going to pop
him back.
Can you please grab her? Yep, I've got him.
The first 2 platypus will stay with Tim for a bit longer, but he's hoping number 3, nicknamed Priscilla, has recovered enough to go back to the wild.
I really like her health, I really like where she's at, and what I would like Kate to do is second that opinion.
Now, what we'll do is have a look at this tail. The tail is a really good way of being able to actually have a look at how thin they are. And by folding it inwards, a bit like you would a piece of paper, you can often tell how much subcutaneous fat is actually in that tail. Great. Feet, no ticks, no little lesions.
Check this out on the front feet. See where the knuckles actually fold?
Yeah.
But then the webbing, watch the webbing. The webbing extends like a duck's foot all the way out. But when they close their hand, their claws come off their knuckles.
Right. Beautiful. She looks gorgeous. Well, this is great. She's in really good nick.
You happy?
I think she looks amazing.
It's good news for Priscilla.
You're going to go back to the wild where you belong.
Hold on.
Kate and Tim are now heading 4 hours north of the reptile park to release Priscilla the platypus.
We made it. The area that we've come to is just on the western side of the Barrington Tops. We've got one last river crossing. This place is not easy to get to, but it's hidden away and that makes it beautiful.
The first job is finding a suitable spot for the young female to call home.
The perfect spot.
The perfect spot. For me, it's really breathtaking to be here. Last year wasn't a blade of grass on the ground. The river was bone dry. There were animals dying everywhere. And to come here now, it almost looks perfect. But it's missing one thing, platypus. Right now, we really just need to find that big pool of water.
Yeah.
And once we do, we'll have our spot to let her go. I'm looking for key indicators. Is the water clean? Is there fresh water coming in? Is the grass green, indicating that we're not just going to have topsoil erosion into the water? All of those boxes are ticked here right now. And that's the exact type of structure that we want. And they don't mind walking up an embankment if they have to.
Yeah, okay.
They'd much rather enter from the water, but this all looks great. Kate and I have walked along a few hundred metres of riverbank, and then with a big halo over it is the perfect spot. The still pool that we've been looking for. There's a natural ford, a rock wall, that's making a dam behind it. Nice flowing current with deep pockets. This is Priscilla's new home. She travelled well.
She did. I can see why this is a good platypus home. It's absolutely beautiful. So now all we have to do is say our goodbyes. Make sure you dig a really, really big burrow and get enough to eat, all right, girl?
She doesn't want to go.
No, I know. She loves it.
Wow. For me and my team, this is the ultimate. All the hard work pays off. Look at her, just clambering over those rocks. She knows exactly what to do.
I know how much effort Tim and the crew have put into Priscilla, and I know how hard this has been to get them back to this point. I think the rush that you feel when you actually release these kind of animals is exhilarating, and I don't think anyone really understands how amazing it is unless you've been there.
Get ready, because when she goes, she's gone.
There she goes.
Oh, well done, thank you.
So good.
It was a good day.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way. Yeah.